From San Francisco, it's Grumpy Old Doc with Dr. Gene Bede.
Hello, everyone. This is Dr. Gene Bede. Welcome to the Grumpy Old Doc. Lulu's on the mixer board today. Today we're back in the studio and on the phone. You know, when we talk to people on the street here in San Francisco about healthcare reform, people seemed pretty well informed. But lots of them seemed unsettled about what is to come out of Washington. Some folks said it was complicated, complex. Others said it was deliberately, outright, opaque, intentionally, with zero transparency. And I don't have the savvy to address the complexities, or at least all of the complexities, or even speculate about what we are or are not seeing about the process. But I promised y'all to get someone on the show who could discuss these things. I kept my promise. I got someone from the Gorman Health Group. Gorman Health Group specializes in knowing both the government and private sector. Based in Washington, D.C., they provide compliance, education, analytics products, consulting services, and they're familiar with the work of lobbyists. On the line with us is John Gorman, founder and executive chairman. Welcome to the show, John. So what did I miss or get wrong?
Oh, you got it just about all right there, Grumpy Old Doc. It's a pleasure to talking with you again, Gene. Thanks for having me on.
You've been very busy in Washington, right?
Yes, just trying to keep up with the litany of activity around the Republicans' attempt to repeal and replace Obamacare, combined with the very drama-prone president that half of America in its wisdom elected. We are literally pinballing from crisis to crisis here in D.C., and is really beginning to consume a lot of energy up on the Hill, which is going to have direct impact on whether or not care can get reformed in the Trump administration at all.
Yeah. Well, the first thing I want to really talk about is the issue that one of our listeners who we interviewed on the street last week, Isaiah, I believe his name was, he raised the charge that things are deliberately being done in an opaque fashion. Now, most everyone said it's complicated, they don't understand things. And what I'd like you to talk a little bit about is how much of it is just innate complexity of healthcare and healthcare reform, and how much of it really is backroom, smoke-filled types of things.
All of the above. This has actually been the most opaque process I've ever seen, with a major piece of legislation that's going to touch the entire U.S. economy without a single congressional hearing, or many of the members who voted on it even having read the bill in question.
Now, can you compare and contrast that for me with the ACA? Because I think one of the popular thoughts going around was that a similar thing happened with the ACA. There were no Republican votes. Nancy Pelosi said, you really have to pass it before you know what's in it. Is there a difference between the ACA was going through the Democrat Congress and the way the repeal and reform appears to be going through a Republican one?
Absolutely, almost black and white differences, honestly. The Affordable Care Act evaded in full view of the public with almost 60 congressional oversight hearings that were held on its various components. It took almost a year and a half for it to be passed. It went through some funky legislative and procedural maneuvers to get to yes, but whoever's party in power always does that.
Yeah. But the difference is transparency. You know, the congressional hearings, I'm not sure most folks appreciate the difference of passing something that had 60 congressional hearings versus one that had maybe one.
Also not to be lost here is the fact that the Democrats made sure that their bills were scored by the Congressional Budget Office, so they actually knew the impact of what it was that they've been voting on. The Republicans have not done that, and in fact, it's a little baffling that they've got their own hand-picked guy over at the Congressional Budget Office these days. They have really been trying to sandbag the Congressional Budget Office estimates on this bill because it's so unflattering based on its impact. You'll recall that the scoring that CBO gave Trump Care was that it would, in fact, add to the deficit and that it would kick as many as 24 million people off of their coverage. So there's a reason that they're trying to keep this thing opaque and not transparent. They're avoiding scores from the Congressional Budget Office, and they're trying to ram this thing through with every parliamentary trick at their disposal, because this is literally the worst piece of major legislation that we've seen here in D.C. certainly in my 26 years that I've.
So what do you think is the biggest issue right now in healthcare reform that isn't getting enough airplay? Because we hear a lot about some of these issues like pre-existing conditions and Medicaid to some degree. But there are some things, if it's such a complicated thing, what's in there that we should all be worried about that's not getting any airplay?
Or enough airplay. You touched on it briefly, Gene. It's Medicaid.
Okay.
This is the most draconian proposal for Medicaid that I've ever seen in my career here. It would slash $880 billion out of the program over a 10-year period. It would probably knock north of 10 to 12 million people off of their coverage in Medicaid. It would convert the program to a block grant or a per capita cap that would not be adjusted like an entitlement program would be.
Would they do that nationwide, or would states have the option to opt in or opt of a block grant?
Well, they would be given the option to do it, but we know there's 30 Republican governors that are amenable to it.
But there's John Kasich. Are you including him?
No, he's actually not a real fan of block grants, and I think he knows.
Yeah, I think he's a little different than the cut of the cloth. So let me ask you, though, real quick, John, that's what they're proposing to do to Medi-Cal. What are we doing to Medi-Cal today? I had a little birthday reading a few weeks ago, the mega regulation. It looked like it was over 1,400 pages, and when I read that, that looks like they're going to try to shut down every Medicaid plan in the country with that mega regulation.
That mega reg actually was not as bad as it may look.
It sure looks bad.
Yeah, I mean, it's the biggest regulation that Medicaid's had in a dozen years. But what was good about it was that it was streamlining all of the regulatory connects that occur in the program between Medicaid, Medicare, and the Obamacare exchanges. And that's really important because of the amount of churning that goes on among low-income people who bounce on and off of the Medicaid rolls, like when they get a temporary job, and then say they go into the California Health Connection out there, the exchange. It's very important that there be a streamlining of the rules that govern these three programs. And the mega reg actually did that, which is why it's so complicated.
Yeah. It also did new things, though. It put requirements that were only previously applicable to the dual eligibles, the Medi-Medis, or the Medicare population. And now it's, in some cases, rather inappropriately layered them over a Medicaid population for which they will be impossible to achieve.
Well, I think,
you know, for instance, giving the individual care plans and health risk appraisals, very different to do it for a senior that is generally able to be contacted and willing to talk versus a Medicaid recipient that A, is not able to be contacted, and B, is unwilling to talk.
That can be difficult, but that also underscores the reason why lower income folks need these kinds of services like the risk assessment and other counseling on using their care, because these are obviously very vulnerable folks who are underserved by the system today and who are more likely to use very expensive settings for care, like an emergency room, for basic primary care needs.
Okay.
So I think it's important to note that there was not a real clamor of outrage from Medicaid health plans about that reg for the reasons that I stated.
You know, when I was interviewing the man on the street, I concluded with a statement from the man on the street that if you don't have money, don't get sick. But my point before that was one of my biggest concerns in healthcare reform that's not getting any airtime, and it's difficult to explain because it's a double negative. It's the removal of the ban on lifetime caps in commercial insurance. So many people I talked to said, you know, healthcare reform's not going to affect me. I have good insurance from my employer. But this affects people from their employer, and I haven't heard diddly squat about it in the media.
There is not a single person in this country that would not be impacted by the bill the Republicans are considering. Even if you've got great, stable, employer-sponsored coverage, you are going to feel the impact of Trump care if it gets as far as enactment, which, to be honest, I'm not sure in its current form it's ever going to see the light of day. The point that you made about employer-sponsored coverage and lifetime limits is an excellent one. But then, you know, you just look at the impact of the pre-existing conditions piece. mean, there's 52 million people in this country, Gene, as you're aware, who have chronic conditions that would qualify as a pre-existing condition and would allow insurers to underwrite and upcharge them like we did in the bad old days, pre-Obamacare.
How about what one of our listeners suggested? He said, why don't you have a ban on prohibiting pre-existing conditions for the next 2 years? Everybody who wants to get health insurance between now and then is fine. Afterwards, well, you're going to have to pay a penalty then. If you can't figure it out in 2 years, you need to get health insurance. That'll be a more effective penalty than anything they tried to do through the IRS and Obamacare. What do you think of that idea?
I mean, I like that sort of idea, but my biggest criticism of Obamacare had always been that we don't do individual mandates well around here. I mean, if you want to look at how you do an individual mandate, Gene, you need to look no further than Switzerland, which in effect would confiscate 50% of your income if you didn't sign up for the National Health Insurance Program.
Well, that's what happens if you don't pay a parking ticket here in California. They fine some check.
And what happens is you pay your parking tickets, right?
Yeah, one way or another.
And only when a mandate or a penalty like that has real teeth do you get the pooling effect of universal coverage. The individual mandate that we put into Obamacare, I have a younger brother who lives in Lake Tahoe who's a professional poker player, and he is exactly one of the young invincibles that Obamacare was designed to try to get under the tent of insurance, and he never did because the mandate penalty was never big enough. He famously said to me, and I will remember this till my last days, if parking tickets only 50 cents, then why pay the meter?
Like I said, it's a parking ticket. So let's finish up here because I want to ask you something related to all the stuff we're talking about. For instance, the suggestion that came from our listener, sort of a centrist suggestion, sort of a compromise suggestion, which we don't see a lot of coming from any quarters in Washington. Now we have all the turmoil around the White House. How is politics going to influence policy in healthcare over the next year or two? Are there any players we should watch that are reasonable?
Yes, politics affects this profoundly and has ever since the enactment of Obama. The Republicans have been on an absolute scorched earth campaign to sabotage this legislation since its enactment, and they've been pretty effective at it, especially with the risk corridors and some of the financial backstops that insurance companies need to price these products competitively. A lot of that was undone by Senator Rubio and others a few years ago, and that has had a huge impact on the pricing of these products and the ability for folks to buy them with the subsidies that it's done. The folks that I would watch in the Senate over this next couple of months are going to be the moderates that are going to determine whether or not this thing passed. This is just a simple numbers game, Gene.
Who are they? Who are the moderates? Like I said, I'm looking for consensus. I'm looking for moderates. Tell me who you would say is a moderate Democrat that might be willing to cut a deal with the Republicans in the Senate, and who's a moderate Republican that maybe can influence his peers.
You look at a Senator Bill Cassidy from Louisiana. You look at Susan Collins from Maine. They explicitly submitted an alternative to Trump Care several weeks ago. It hasn't gotten a whole lot of traction, but they are actively trying to get a working group of centrists around a proposal that's not nearly as savage as what we saw in the American Health Care Act. I'd also be watching Shelley Capito out of West Virginia, Rob Portman out of Ohio, Lisa Murkowski out of Alaska. They are really the hardcore of the centrists, but they're also representing the Republicans that are representing states that took the Medicaid expansion. And they certainly don't want to see that coverage unraveled in their own state. And that is one of the biggest planks of Trump care is that Medicaid cut and transformation I mentioned earlier. They're going to have none of that. And when this comes down to a simple numbers game, Gene, of the fact that the Republicans have only 50 seats, meaning they can only lose 3 votes, and both Cassidy and Collins have already said they are not having anything to do with repeal of Obamacare in its current form at all, in deep trouble on any bill that would get them to the number of votes necessary to, and then if you remember Schoolhouse Rock, Dean, and I'm Just Bill, even if they get something through the Senate, which would inevitably require Vice President Pence